like to introduce John Boyle. He's a physician assistant who has been my partner for the past 14 years. And we like to demonstrate what the typical post-operative dressings would look like following shoulder arthroscopy and to a large extent following shoulder open surgeries such as shoulder replacements. When you return home following shoulder surgery after a shoulder arthroscopy, I recommend that it is safe for patients to shower the day after surgery. If you've had an open procedure such as a shoulder replacement or an open stability repair, I believe that it's safe for you to remove your dressings and shower on the third day following surgery. The typical dressings will look similar to this as you see here. It's got a big padded cotton dressing that's covered with tape to secure it to your shoulder. Following shoulder arthroscopy, it's not unusual to see some fluid collecting in the dressings. When we perform that type of surgery, we pump a lot of saline solution through the shoulder, and following surgery it's natural for some of that saline to leak through the skin incisions despite that they are closed with sutures. And so you'll see a blood-tinted fluid or a reddish-tinted fluid that may build up in the dressings, and this is not alarming to us. If you were to see bleeding that looks more like true blood that's leaking out from the dressing, that would be more of a concern and should prompt a call to us. When you're ready to remove your dressing the day after surgery or the third day after surgery, I recommend you peel the dressing off like such. Begin at the top of the shoulder, and take the tape off from the front, and then from underneath the arm, like that. Typically at this point you will see a yellow non-adhesive dressing called Zeroform. This is an antibiotic impregnated dressing meant to reduce infections but also to keep the dressings from sticking to and adhering to the skin. It's safe to peel these Zeroform dressings off. In some cases you may see a second layer of what is called steri-strips. These are Band-Aids which are meant to remain on the skin for the first 7 to 10 days until we see you back in the clinic. So you can shower right over the top of any steri-strip type Band-Aid. I recommend that when you shower that you try to avoid directly pulsating the water on the shoulder, though I don't mind if water washes across, and I don't mind if soap washes across the shoulder. After you're finished with your shower, I suggest you take a towel and blot dry. Make sure it's good and dry, and then you may apply Band-Aids to cover over the incisions at that stage. Following shoulder replacement surgery, once you're completed with your shower, generally it's not necessary to apply further dressings, but if you want, you could apply gauze with a light tape coverage.